Good afternoon, everybody. Good afternoon, everybody, and you're all very welcome here to the Alex Hotel in Dublin City Centre in Ireland for the launch of the Limerick Framework for Action, advancing the Global Health Promoting Campuses agenda. Tá fáilte mór roimh go léir an seogadtaí baile clia an éireann agus is onóir agus privilégh dul mhór doing go léir as ollscoil ní tror a thuirt den ócáid speisialta seo. My name is Catherine Norton. I'm representing the University of Limerick. For those of you who are either online or in person who attended the Healthy Campus conference in Limerick, you might remember some of the team who were represented at that time, and many of us will be presenting here today. We are delighted to have so many of you join us for this really spectacular, momentous occasion. And you can see from the slide that there are colleagues, friends, stakeholders, international collaborators from around the globe represented from each of the continents who participated either in the collaborative co-creation process or in the consultation that has gone on over almost an 18-month period. It feels like 18 years sometimes. So we're delighted to have as many as over 600 people join us online, and the room here in Dublin is about 50 strong, so we're delighted to welcome everybody. Over the course of the next hour or so, we'll hear from dignitaries, guests, stakeholders, a whole host of people who have been involved in this process, and each of the segments will be introduced to you as we progress through. On a couple of housekeeping issues, for those of you who are in the room here, you please take note of the emergency exits in the event that we should need them. We would ask you all to please put your phones on silent or turn them off entirely if you can feel you can do that for the 90 minutes that we're together for this special occasion today. For those of you who are joining us online, there is a Q&A function whereby if there are any questions or comments or feedback that you'd like to log, you can do it there. Dependent on how busy this channel is, we'll do our best to get back to you as soon as we possibly can. And if we don't manage to address all your comments or questions during the event, we will follow up afterwards. And now I'm going to pass you over to Caroline Mahan.
Hi everyone, we're doing a bit of a tag team today, so hopefully that works. And hi to everybody online. So my name is Caroline Mahan and I'm the National Healthy Campus Coordinator at the HEA. So I guess essentially my role is to progress national policy in relation to student and staff health and wellbeing, which I do with my colleagues Ross, Tim, Kristen and Ruth. I guess being part of the international network, the 2025 conference and the development of the framework has been a personal highlight for me, but also something that has and will contribute greatly to shaping our national agenda. And we can already see the influence that the Limerick Framework is having. So I'm delighted to introduce our Minister for Further and Higher Education, Research, Innovation and Science, James Lawless, to officially welcome you to today's launch with a recorded message. I guess the Minister's support is integral to the work that we do, and we really celebrate his address today.
Very sorry that I can't be with you today in person for this important occasion, but I am delighted to join with you virtually. First, let me thank you for inviting me to speak and to welcome everyone gathered at Alex Hotel this afternoon, whether you're here in person or joining in online. Today is about recognising the people who stood at the forefront of progress and the effort it takes to achieve something as ambitious as this framework. It is also about acknowledging the many voices from across the globe who contributed to this work, too many to name individually, but each one deserving of our gratitude. A warm welcome also to Lord Mayor of Limerick, John Moran, and a particular thank you also to Professor Catherine Woods and our team from the University of Limerick, who, in collaboration with the Atlantic Technological University, hosted the International Health Promoting Campuses Conference in June of this year, which has led to the Limerick Framework for Action, advancing global health promoting campus agenda. To all the stakeholders who have been involved in this framework, from within our own island, colleagues in the Higher Education Authority and the Department of Health, the universities right across the world, UNESCO, the World Health Organization, and the International Union for Health Promotion and Education. Those working and researching health and well-being across college campuses, I congratulate you on reaching a comprehensive guide for action, which will benefit students, staff, institutions, and campuses in the promotion of mental health and well-being. The Limerick Framework 2025 will guide institutions around the world in advancing student and staff well-being and realise the aims of the Okanagan Charter, The Okanagan Charter called on post-secondary schools to embed health and well-being into all aspects of campus culture and to lead health promotion, action and collaboration locally and globally. Since its creation in June 2015, the Charter has offered institutions a common language, principles and framework to become health and well-being promoting campuses. The world is, of course, a very different place since 2015. We've seen the adoption of the UN Sustainable Development Goals, the impact of climate change, COVID-19, rapid digital transformations and technological advances, the commercial determinants of health, global inequality and powerful social movements. The Limerick Framework brings together the conceptual vision of the Okanagan Charter into practical implementation with measurable impact. It focuses on action and provides a roadmap for a whole campus approach to health and well-being through its 10-action model. It includes the promotion of a healthy planet, healthy place and healthy people. And it calls on institutions to empower students and employees to reach their full potential and support institutions to respond to global and societal challenges, something that COVID highlighted all too clearly. Ireland is proud to drive the health promoting campus agenda globally through the launch of the International Limerick Framework and through our national policy on student and staff health and well-being across higher education. Ireland is one of the few countries in the Global Healthy Campus Network to have a national policy in relation to both student and staff health and well-being. In 2022, the Higher Education Authority formally took over the implementation of the Healthy Campus Charter and Framework. This charter aims to embed health and well-being more broadly within higher education institutions and provide strategic direction on developing a whole campus approach to health and well-being. The Higher Education Authority Healthy Campus Network actively supports institutions to progress student and staff health and well-being and includes representatives across the sector. Much work has been undertaken in this area in recent years. The Higher Education Authority oversees two core policy frameworks to support student and staff health and well-being: the 2020 National Student Mental Health and Suicide Prevention Framework and the 2022 HEA Healthy Campus Charter and Framework. My department has provided €31.9 million in additional funding for student mental health supports since 2020. This funding is to further support higher education institutions in meeting the mental health and well-being needs of their student population. This targeted mental health and well-being funding provided by my department will support students to reach their full potential in their journey through higher education. The higher education institutions in receipt of this funding are encouraged to use it in support of specific student-facing areas, such as recruitment of additional student counsellors, recruitment of additional assistant psychologists, head of service posts, training of staff to enable them to support and refer students to appropriate services, raising awareness among students of mental health and well-being services available, including through student outreach activities. It gives me great pleasure that many of the new posts, which were created through this funding, have been counsellors, reflecting the capacity building phase of the implementation of our national frameworks. As we all know, education and health are inextricably linked. The transition into higher education is a major turning point in a person's life, which can include moving away from home, a change in their peer support, new environments, new experiences, freedoms, and a new way of learning. By its very nature, it can be very exciting, but also a challenging time. The college years are also an important developmental period when young people transition from adolescence to adulthood. Against this backdrop of change, and indeed the many societal pressures that face students, it is imperative as policymakers that we support our students as they enter college and throughout their educational journey, such as we are doing through the Okanagan Charter and the Limerick Framework. Again, I would like to say a sincere thank you to all involved in developing the Limerick Framework. Your dedication and commitment to improving the life of our students will make a real difference. The habits and behaviours formed are reinforced during college years to shape future health and the health of future generations. Is ja hampla é an obair atá ar siúl a gcuimhin seo. The work you are doing here sets a great example. Go raibh maith agaibh go léir.
Well, hello everyone. Greetings from the University of Alabama at Birmingham in the U.S. As co-chairs of the International Health Promoting Campuses Network, we are delighted to join you in celebrating the launch of the Limerick Framework for Action. This is a significant milestone, not only for Ireland, but for the global health promoting campuses movement. We extend our sincere thanks to the Irish Higher Education Authority and the University of Limerick for your leadership, both in hosting the 2025 International Health Promoting Campuses Conference and in stewarding the thoughtful, collaborative process that produced this framework. This moment is especially powerful in our shared history. The 2025 conference marked 10 years since the Okanagan Charter, 20 years since the Edmonton Charter, and almost 40 years since the Ottawa Charter. Each of these milestones reflects the evolution of health promotion, and today the Limerick Framework clearly stands as the next chapter in that story.
Hello everyone, and greetings from Vancouver, Canada, from the University of British Columbia, and thank you for inviting us to be part of this important occasion. It's truly an honor to join you for the launch of the Limerick Framework for Action, and this work really does reflect an extraordinary level of collaboration, scholarship, and commitment. I'd like to start by extending thanks to the International Health Promoting Campuses Steering Group, our national and regional networks, many of whom are here, World Health Organization, UNESCO, the International Union for Health Promotion and Education, and the many scholars, practitioners, and students worldwide that contributed to this process. This framework is really the product of collaborative leadership and shared purpose.
In just a few minutes here, we're going to ask each other a couple of questions and share a few thoughts with you guys. So, Matt, let me first ask you a question. Given the theme of the conference, which was where from, what next, where to, can you tell us a little more about the International Health Promoting Campus Network context that led to the Limerick Framework?
Yeah, in 2014 I began my role at University of British Columbia and joined the international conversation that was happening with institutions around the world. And there was really a shared desire for a holistic framework that connected health, well-being, equity, and sustainability directly to the core mission of higher education in teaching, learning, research, and community engagement. And I think that shared realization led in 2015 to the co-creation by almost 100 institutions around the world of the Okanagan Charter for health promoting universities and colleges. And the charter, for those who aren't familiar, was named after the Okanagan Valley in British Columbia, which is on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation where it was created. And now here we are 10 years later, and we're at another pivotal moment. And as a global network, I think we all felt like it was time to pause, reflect, and re-engage. And so we really just want to acknowledge the University of Limerick with the strong backing of the Irish Education Authority that took on the challenge with remarkable care, rigor, and political will. And throughout this process, we've heard a consistent message from the global community that the Okanagan Charter remains deeply relevant and foundational, but the context has evolved in 2025. And there are new areas of focus that are needed to strengthen our implementation and to respond to some of the realities of today. So I really think the Limerick Framework for Action is the result of that careful listening. Okay, Rebecca, I'm going to turn it back on you for a minute and ask you if you can speak a little bit to the strength of our International Health Promoting Campuses Network and the opportunity that Limerick Framework has to continue to guide this conversation.
Well, honestly, the timing of this framework could not be better. What really began as a vision shared by a small group of institutions has now grown into a truly global movement. Today, more than 600 universities and colleges across roughly 40 countries have adopted the Okanagan Charter and formally aligned with the Health Promoting Campuses agenda. Beyond adoption, what's been most exciting to witness is the rapid growth of national and regional networks. Just even over the past year alone, we've had some new and renewed conversations to establish or strengthen networks in places all over Scandinavia, in Eastern Europe, like in Georgia, in Europe, like in France and Turkey, across the Middle East, in Africa, China, Singapore, even beyond. So at the same time, there's been this renewed engagement with international convening bodies such as the World Health Organization, the International Union for Health Promotion Education, and UNESCO. And those are the organizations that really shape these global agendas and provide powerful alignment points for higher education. So the Limerick Framework for Action arrives at exactly the right moment to focus, connect, and accelerate this momentum. It's kind of bridging policy, practice, research, and education across diverse cultural and political contexts. So Matt, another question for you. Which of the 10 new actions is the Limerick Framework, which one resonates most for you?
It's hard to choose. But the action that I think strongly resonates for me right now is Action 8, which is around mobilizing and empowering students to be active local and global citizens, future decision makers, and change agents. So yeah, it's nice to see this increased focus on empowering students. And I often, think that that might be the greatest opportunity that universities have, equipping our students with knowledge and skills to go on and transform the world. And equally, we have a responsibility to support their well-being in their time at our institutions, which is a very formative time. So that's the one I'd pick. How about you, Rebecca?
I chose the principle of partnership, which is also an action. For me, that principle of partnership, it's powerful. I think relationships and collaboration are key. It's when we work in this transdisciplinary way that we really, I think, strengthen the foundation for health, well-being, and sustainability. I find increasingly in this global context that we have that there's just renewed importance of human connection and shared culture and being physically present with one another, able to celebrate, in all the ways that we do, with a hug or a high five, to sometimes just sit quietly together, to learn across disciplines, traditions. It's really central to meaningful change. So for me, the Limerick Framework is rightly situating partnership, not as an add-on, but as a core mechanism for transformation.
Mm-hmm.
So maybe we can both talk a little bit about what's next for the network. One of the strongest messages we took from Limerick was the power of coming together in person to share ideas, cultures, successes, and struggles. 10 years between global gatherings we've found is just too long, especially in a world that's facing such rapid and interconnected challenges. And I know, therefore, we're going to place sort of renewed emphasis on more frequent international connection and collaboration, and at the same time, sort of spend some time strengthening the regional and national networks.
Yeah, and to support this further, the International Health Promoting Campuses Network is currently forming several new working groups. So I thought I'd briefly mention what those are, and some of these may resonate for people online and maybe even be opportunities for you to reach out and see how you want to engage and contribute. So one will be around network governance. With the growth of the network and the conversation, we want to explore how the network can strengthen its structure and long-term sustainability through clear governance, shared leadership models, and resourcing. The second working group will be around research collaboration and emerging scholars so that we can build an international community of practice and support more shared research outputs, which is already beginning to, or has really been growing over the last few years. The third group is around around education, training, and development. And that group will look to develop aligned professional learning opportunities, including webinars and a Health Promoting Campuses 101 course, which recently I learned is not obvious to everybody. So when we say 101, that means a sort of introductory course. And then the fourth working group is around charter and framework adoption, where we're looking to develop shared tools, templates, stories, and lessons from global practice to support our institutions. So I think what continues to strike us, if we back up for a minute, is really how common our goals and challenges are across our countries and cultures across the world, and how much stronger we are when we work together. So I'm excited to see this launch, and looking forward to connecting with all of you as this work continues to unfold.
Yes, and thank you so much. Thanks for giving us a few minutes here. Congratulations once again to University of Limerick and the Irish Higher Education Authority, and to everyone that is sharing in this truly remarkable achievement.
Thanks, Matt and Rebecca. And I guess they didn't need an introduction, but they are the co-chairs of the International Health Promoting Campus Network, and they are such a good tag team. And I think the partnership piece really resonated, and probably also the physical coming together. And I know so many people are online, which is great, and so many people in person. But I guess I know we're eagerly awaiting the presentation of the framework, but before we do, we might take a reflection back on the June conference, and we've tried to capture the momentum and the collaboration and the good energy that was the conference in June. I think we had a lot of fun and we did a lot of work. So we're just going to play this recap video for you quickly.
Ten years ago, UBC Okanagan campus hosted the 2015 International Health Promoting Campuses event, where we created the Okanagan Charter. And to me, it was a coalescing of universities from around the world that created a document that became a blueprint, a guide for the work. It helped with the why this matters, and something that we all brought back to our campuses to drive the movement forward. And over the last 10 years, it's been remarkable to see the number of additional campuses and countries who have found that to be a helpful way to work together and to drive change forward in health promotion.
The hosting of this conference has been meaningful to me personally in UL, because I've got to meet some really, truly excellent colleagues and peers that are doing similar work, health promotion and well-being, in other campuses internationally. And it's also meant that we've been able to spotlight the University of Limerick a little bit, which is really helpful for us in our journey forward.
Something about this conference, the fact that we're focused on sort of a healthy planet and healthy places and healthy people. I mean, you're watching 400 people from 40 different countries, all passionate about the same exact thing, and all coming together, talking about whole campus, setting space, salutogenic approach. It's just really incredible to see so much similarity. And I wish that there was some way that we could take what we've done here in terms of bringing us together as people, just as people who all dwell on the same planet, and just bring us together in that way every day.
When we originally bid for the conference, we wanted to take an opportunity to showcase the work that Ireland does on a national basis, but also the work that the University of Limerick and the region do to put planet, people and places at the fore of all of the things that we do. So I feel that we've not only demonstrated the expertise and the capacity that we have in health promotion in higher education in the University of Limerick, but also the commitment that the wider region has, and nationally, and in particular the government involvement that we have within the health promotion campuses movement.
Yeah, so one takeaway for me is, I guess, first of all, it's the energy in the last 4 days. There's so much momentum around health promoting campuses, and everybody here is so passionate, and I think we really just want to harness that and keep going and keep moving.
I think health and well-being is important because students really need to feel like less isolated, and they need to have a feel to be like a part of campus culture, because when students feel a part of the campus, their grades will be better, and I think all around they'll have a better experience in general. So definitely health and well-being being implemented at universities is crucial for students.
Building on this conference, it feels like there's a huge amount of energy, excitement and passion, and it would be fantastic if that can be held on to and developed further and really make a difference.
Approaching the moment that you've all been waiting for. So it was lovely to look back at the conference that was held in June, when the weather was warmer and everyone had great enthusiasm and passion for what was to come. And now, hopefully, the atmosphere and the temperature in the room is heating up as we're ready to do the big reveal of the Limerick Framework for Action. So I'm going to hand over to two colleagues who will talk you through the highlights.
Hi everyone, my name is Catherine Woods. I'm Professor of Physical Activity for Health in the University of Limerick and also Chair of Healthy UL. Ross, do you want to introduce?
Sorry. Hello everyone. I'm Ross Woods, no relation to Catherine, even though everyone probably thought we were. I head up the HCA's work on teaching and learning, but most importantly for this event on mental health, health and well-being and healthy campus.
Perfect. So I'm delighted, obviously, to launch the Limerick Framework for Action, advancing the global health promoting campuses agenda. But if we start with the journey to Limerick, in 2023, Catherine Norton bounded into the executive meeting of Health UL and said, guys, I think we should bid to host the International Health Promoting Campuses Conference in 2025 in Limerick. We all looked at her and went, you're mad. But she wasn't. She was right. And Ireland, with the support of the Higher Education Authority and the Health Services Executive and Department of Health, put together a bid, and we're successful with our colleagues in Atlantic Technological University to run the 2025 International Health Promoting Campuses Conference. And that began the journey to Limerick. 2 years later, 500 responses to a survey from 49 countries across the globe led us to think about how do we actually advance the global health promoting campuses agenda? How do we do it? What is your voice? What are you saying? And following that with in-depth interviews, because what the surveys was telling us really required further analysis and review. And then we were so fortunate to have over 400 of you actually come and join us in Limerick. Break bread with us, dance with us, talk with us, fight with us, gather ideas and opinions, but effectively shape the language, the structure, and the content that is the Limerick Framework for Action. And that journey brought us to think globally, but act locally. And you heard it in some of the elements that were presented already. Think globally, but act locally. Building on the vision of the Okanagan Charter that ignited the global movement for health promoting campuses. However, the world is profoundly different than it was a decade ago, facing different demands for different engagement, different ways of thinking around health, well-being, and sustainability. In part due to our advances in technology, our digital era. This is after COVID-19. Our teaching spaces have changed massively. Global inequalities, social movements, the Sustainable Development Goals, climate change, the public's reduced trust in science, changing demographics of the population we're teaching, the populations we're living in. All of these challenges required higher educations as central places for learning to have a vital role in helping us tackle these challenges. And that's where the vision comes from the Limerick Framework for Action. Our vision is for everyone in higher education to promote health, well-being, and sustainability, to tackle the challenges of this changing world, as by embedding health, well-being, and sustainability across all aspects of higher education, health promoting campuses will promote a healthy planet, healthy places, and healthy people, will empower our students and staff, our employees, to not only survive, but to thrive and reach their full potential, to strengthen our local and global communities, and to support meeting the Sustainable Development Goals. Through a whole campus approach, our vision is that using action-oriented implementation, the Limerick Framework for Action reaffirms higher educations as vital catalysts for transformative health promotion.
So I guess everyone is wondering, what's the purpose of the framework? And luckily we have this slide which says purpose, so I'll explain that now. So the Limerick Framework for Action is essentially an action plan that encourages all higher education institutions to become health promoting campuses to meet these challenges in this new world that Catherine has outlined. It invites everyone involved with a higher education institution students, employees, staff, and also the communities surrounding the institution to take part in this shared endeavour. As Catherine has mentioned, by placing health, well-being and sustainability in all areas of higher education, we can promote a healthy planet, healthy places and healthy people, help students and employees reach their full potential, strengthen local and global communities, support the UN's SDGs. What the Limerick Framework for Action provides is a roadmap for the collective implementation of health promotion efforts across the whole higher education system. Normally, when I say higher education system, I'm talking about Ireland. I'm really happy to be not just talking about the Irish higher education system, but the global higher education system. Rooted in a settings-based approach to health promotion, this framework supports health promoting campuses and their communities to translate strategies into action, creating healthier environments for the planet, places and people.
So to realise this whole systems approach, the Limerick Framework for Action calls for a strategic combination of both upstream and downstream approaches. What do we mean by that? Well, upstream would be policy actions aimed at improving the social, cultural, economic and environmental factors that support health and well-being, combined with individually focused downstream approaches that may be more educational or programmatic focused. And to do this, we have 3 pillars and 3 principles. The pillars are healthy planet, taking practical actions to protect our environment. Healthy places, creating safe and inclusive campuses for everyone, both in our physical and importantly in our digital spaces. And healthy people, ensuring everyone can learn, work, live, love and thrive within systems that promote the importance of well-being for all. For healthy people, we need a healthy planet and well cared for places.
These pillars are, as you can see, underpinned by 3 key principles: partnership, participation and progress. In partnership, we want to work together on local, regional, national and global levels. Through participation, we want to involve everyone, especially in decisions that affect specific groups. Progress, it's really important, and this is why I think we need a framework for action. And to achieve progress, we need to take action that can be measured, but also celebrated. To achieve meaningful progress, we must collaborate and include everyone. The framework, and this is really important, aims to put Indigenous knowledge and experience at its centre. For those of you in the room and online, these pillars and principles, you can use them to guide you, to assess how ready you are to advance the goals of being a health promoting campus, to build partnerships across departments, surrounding communities and public and private sectors, to enable health promoting environments and to track progress, and I think most importantly, to celebrate achievements. The pillars and principles ensure the framework is a flexible guide for change that can transform higher education institutions into healthier, more inclusive and sustainable communities.
To support the realisation of the vision that was the Okanagan Charter and now built upon by the Limerick Framework for Action, 10 key actions are recommended. Each action is a practical guidance about embedding health into all aspects of campus life and to lead health promotion action globally and locally, However, the actions are not prescriptive, but serve to empower your campus, your community. So you have 3 here on the slide in front of you. 1, ethos. 2, act. And 3, localize. What do we mean by ethos? Well, adopt or advance a shared ethos of stewardship, caring for planet, places, and people. And to do this, for example, HEIs can assess how ready they are, their readiness level, their level of commitment to make these 3 pillars, people, place, planet, a core part of their learning curriculum. Act. Adopt an action-oriented approach to health and well-being is the second action. Higher education institutions, we know, with an action-oriented approach that is evidence-informed and uses systems thinking, are much more likely to succeed in embedding health and well-being into all aspects of campus life and achieve meaningful impacts. So the action here is to embed this proactive approach in all areas of education and society. And the third one here is localize. This framework is a global framework. We need you to take it and localize it with agility and responsiveness. Translate the global framework into your own tailored, locally owned action plan. Higher education institutions have unique assets, unique barriers, cultural nuances. So take the framework, localize it with agility and responsiveness, and ideally, as we have in Ireland, integrate it into your education and health systems.
And then we have the next three actions. The next action I think we see in every single framework that we publish in leadership, and I think it's really important to have leadership and to strive for collaborative leadership and shared responsibility in this work. It's I guess really important in order to move from a charter to action to secure high-level executive leadership for health promoting campuses, and for that leadership to be values driven and collaborative, because only that type of leadership can really accelerate cultural change. The next action is around policy, which I think is what's really nice to see in a framework like this. We see it in our own Healthy Campus framework, but is the mix of policy and practice. There are policy makers like me that are great at putting things down on a piece of paper, but policies are only as good as those who implement them. So in terms of policy, what we want to see is health, well-being and sustainability considerations being integrated into all policies in our universities and colleges. Institutions should take a whole campus approach in integrating health, well-being and sustainability into their core functions. And finally, the last action I'm going to speak to now is action 6, culture. And this is to engage and collaborate with campus communities to foster a culture of health and well-being, physically and virtually. I think it's the framework for action sets out the importance of promoting a relationship-rich culture amongst students, employees and communities. And within this context, it's really important to develop networks and communities of practice that work collaboratively with students and employees to create sustainable and inclusive living, learning and working spaces in both the physical and, importantly, virtual environments of our higher education institutions.
Actions 7, 8 and 9. Number 7 is partnership. And although this is also a principle of the Limerick Framework for Action, it is a standalone action. Why? Because we believe in its power and its importance. And the action is about developing and strengthening partnerships for health, well-being, and sustainability. It's a call to action asking higher education institutions to work beyond the campus with partners who can help advance health, well-being, and sustainability in your campus, to harness higher education wisdom and influence accumulated through research and learning to advocate for human and planetary health. We know structural transformation is most effective when higher education institutions actively engage, not only with internal allies, but with external stakeholders, the likes of WHO, UNESCO, and others. You will know them better in your own contexts, in order to amplify and advocate your efforts. Students, mobilize and empower students to be active and global citizens, future decision makers, and change agents. Develop among our students graduate attributes so that they are competent and engaged local and global citizens, enabled to promote their own better health, but also that of the planet and their higher education institutions. And finally, on this slide, research. Strengthen and embed evidence and innovation for health promotion. This will require inclusive, evidence-based research. Work to fund, conduct, and prioritize research on relevant issues in order to really advance the field.
And then the last action, so surprisingly they've left the last action to the man from the state regulator, and it is celebrate. It's not something I get to say an awful lot when I'm up on a podium. But again, I said this before, I said we talk a lot about tracking and measuring, but one of the things that I like the most about this work, and we see, I think it came through in Matt and Rebecca's words as well, is this idea of celebrating, to celebrate progress and to recognise contribution. We talk a lot when we talk about Healthy Campus, meeting people where they are and helping them on their journey. Catherine began talking about the Limerick Framework as a journey, and I think work to embed health promotion in our campuses is a journey, and I think that there are different ways to celebrate, to share impact stories, to show achievement and celebrate progress in terms of health, well-being and sustainability. And this is really important. I think it's laid out in the framework because recognition nurtures ongoing commitment and supports innovation and momentum, and the acknowledgement of activity helps people to move from intention to implementation. I would ask those of you, in the room, but also more so, I think, the hundreds joining us online, to use your local, regional, national and global networks to create awards, publish impact stories, host annual reflection forums, share progress reports, seek collaborative solutions for common challenges, and disseminate widely via digital platforms for interaction, so that the Limerick Framework is a living document. And you can also check out the website that we have for the IHPC conference, which gives a great example of a celebration, and it shares many case study examples of progress from the book of abstracts, learnings from the plenary sessions and so on. And then I'll pass over to Catherine to bring us to the end.
So this is it, guys, the Limerick Framework for Action, advancing the global Healthy Campuses agenda. So you can, this is the DOI that you can get it at. So you can either take a record of it now if you're online, or, and you can see here we have two versions. One is a technical document, and that's really for the experts, the researchers, those of you that are tasked with delivering on the health and well-being agenda in your campuses. There's also a plain English version, which is more for individuals who may not be as expert in this area, but are very interested and want to learn more. So please do use both versions. We also have the website that Ross was talking about. This is now live on the Higher Education Authority. And the link is down below, www.hea.ie/policy. Go into health and well-being, you'll find it there. And you can see the whole, everything about the conference in June. All of the plenary sessions are recorded in there. The book of abstracts is there. There's loads of examples and resources available to you there. So please do access those. So next steps. What are our next steps? So for higher education institutions, first of all, access the Limerick Framework for Action. You've got the websites now, you can find it. Commit to work through the 10 key action areas. Monitor your progress, and importantly, let's meet up to celebrate again. Rebecca and Matt alluded to meetings more frequently than once every decade, so we're looking forward to that. But in your own national networks, regional networks, and the global network, make sure you meet up online, in person, to share and celebrate. Translations of the Limerick Framework for Action are very welcome, so if anyone's interested and would like to translate, help us with translations of it, please do get in contact. Next steps for the International Health Promoting Campuses Network. Matt referred to the 4 working groups that have just been established. One on strategy, governance, and infrastructure. One on research collaborations and emerging scholarships. One on charter framework adoption and commitment. And one on education, training, and development. So make sure you get involved with your local network, your regional network, join one of the special interest groups that you're interested in, or more than one if time allows. So that brings us to the end, and just to say a massive thank you on behalf of the Framework Development Team, to say a very big thank you to everyone who contributed. Thank you to our funders, the Higher Education Authority, the Department of Health, the University of Limerick. Thank you to the International Health Promoting Campuses Network. Without your reach, your welcome, your introductions to all of the networks across the globe, the framework would not be the strong document that it is today. And thank you most importantly to everyone who responded and contributed, who took time to reflect on the questions we asked, who took time to provide all of that feedback that we sifted through, analysed, and reflected on ourselves, that engaged and, importantly, took time to advance the global health promoting campuses agenda. Thank you all very much.
I'm relieved and excited, and I don't know which one is there in the greater amount at the moment. It's just so lovely to finally have this framework over the line, and to have a physical and a virtual copy of it available for you all to look at and to share and to comment on and to provide feedback on. So we're looking forward to that. I'm now going to hand over to Sarah Kennedy, who's the Healthy UL Manager.
Thank you, Catherine. So, hi to all, and I'm delighted to be here with the team from UL, but I'm also here as a representative for the Healthy Campus Network and our own national network. So I'm delighted to represent this network, a group of like-minded people who are very passionate about embedding health and well-being and, you know, are already acting locally and embedding health and well-being within their own institutions across the island of Ireland. I'd like to offer them a special thanks today on behalf of the Framework Development team for their very active support and participation in the conference itself in June in Limerick. We're delighted to welcome you to the University of Limerick, and also in the process of creating and developing this framework. We're very grateful to you, so thank you. And it's wonderful to see so many familiar faces today. I'm also going to welcome some of our colleagues from around the world who took time out of their busy schedule to record a brief video on what this framework means to them. So I'm going to hand over now, and we welcome.
It represents a significant milestone for the global health promoting campuses movement. 10 years on, it strengthens the bold vision and calls set out by the Okanagan Charter, proposing 10 actions underpinned by guiding principles and 3 interconnected pillars. I really hope that the framework will inspire and enable higher education institutions and health promoting campus networks around the world to translate their commitment to whole system and whole institution settings-based health promotion into ambitious, tangible and equitable change. Change that can help tackle the intertwined challenges that humanity faces and secure the health, vitality and integrity of the planet, of places, and of the people who live, learn, work, love and play in these places, on our campuses and in their surrounding communities.
El marco de acción de Limerick nos ofrece una ruta clara de cómo orientar la gestión del movimiento de universidades promotoras de la salud a nivel nacional, a nivel regional y a nivel global. En el pasado hemos tenido otros documentos políticos y normativos de referencia. En el caso de la región iberoamericana hemos tenido el documento de Coimbra, la Carta de Niterói, y a nivel global hemos tenido como referencia la Carta de Okanagan. Todos estos documentos son expresiones ideológicas y políticas que orientan la gestión del movimiento global de universidades promotoras de la salud. El marco de acción de Limerick nos traza, como decía, esta ruta de cara a los próximos años de iniciativa del movimiento de universidades promotoras de la salud. Le damos la bienvenida a este documento que constituye una referencia primordial para todos los que estamos vinculados al movimiento de universidades promotoras de la salud.
The Medical University of Varna-Bulgaria is still at the beginning of our journey on the healthy campus route. The Okanagan Charter and the Ottawa Charter were the main documents guiding our efforts up to that moment. And now we are very grateful to our Irish colleagues for the new Limerick Framework for Action, giving us not only 10 clear action areas, but also answers to the questions on what, why, and how we have to act. We send you our warmest greetings from the first health-promoting university in Bulgaria, the Healthy Medical University of Prague.
Aoife Noonan, a PhD candidate at the University of Limerick working with Healthy UL, and I've had the privilege over the last 2 years to collaborate with many individuals from across the globe in co-creating the Limerick Framework for Action. Built through an evidence-informed process, including surveys, interviews, focus groups, workshops, and many months of collective drafting, the framework reflects a vision for a healthier planet, healthier places, and healthier people. It brings forward the voices of students, employees, and communities who are ready for higher education to lead meaningful and lasting change, locally, nationally, and globally. To everyone who contributed, your insight shapes this collective achievement, and I look forward to seeing how the Limerick Framework for Action inspires campuses to think globally, act locally, and create healthier futures for all.
On behalf of the National Network for Health Promoting Campuses of Georgia, we endorse the Limerick Framework for Action. We commit to embedding health, equity, and sustainability across campus life, strengthening mental health supports, advancing tobacco and vape-free markets, promoting active living and healthy food, and using data-driven partnerships to turn policy into practice for every student and staff member.
Where do you see the key advantages of the Limerick Framework for our Austrian network?
For me, the greatest advantage is the shared ethos of stewardship for planet, places and people. It gives our network a common foundation and inspiration and direction. So it helps all members to collaborate more effectively, creating a truly health-promoting campus culture.
I agree. And the framework brings a clear, action-oriented approach. It helps campuses move from ideas to concrete steps, and the emphasis on localizing the framework makes it adaptable to our specific context.
Exactly. So overall, it gives our network a solid structure to advance the health promotion campus agenda together with all our member institutions.
Hi, bonjour from Canada. The Canadian Health Promoting Campuses Network is excited about how the Limerick Framework for Action can help us build upon the legacy of the Okanagan Charter launched right here in Canada in 2015. We're proud to have 55 colleges, universities, and CEGEPs that have adopted the Charter and made commitments to action, along with 8 partner organizations that have endorsed the Charter and pledged their support for our work. The Limerick Framework offers an opportunity to re-energize and reimagine this movement. It will help us to connect our campuses, share learning, and deepen our collective impact on health, well-being, and sustainability. We're already seeing renewed engagement and momentum across Canada as a response to the framework, and we're eager to align our efforts to advance the Global Health Promoting Campuses agenda. We're proud to be part of this international community for change. From coast to coast to coast, we're building healthier campuses, unis pour la santé et le bien-être.
Namaste friends from India. I am Dr. Rajiv Veeraudekar, the Provost of the Faculty of Medical and Health Sciences at Symbiosis International University, Pune, India. We recently had the privilege of attending this conference at Limerick in Ireland, and the conference provided an excellent opportunity to network with like-minded individuals who are working tirelessly to promote the concept of a health-promoting university. In India, this concept is still nascent and is catching up. But as Symbiosis International University, we pledge ourselves to develop Symbiosis International University as a health-promoting university, understanding global best practices and trying to incorporate the same into our constitution, our work processes, and the very culture and fabric of our university. It has indeed been a wonderful learning networking experience, and we look forward to take this momentum forward at Symbiosis and in India. Thank you.
Hi, I'm Chris Daw, past chair of the U.S. Health Promoting Campuses Network and a proud member of the International Steering Group. For the past decade, the Okanagan Charter has guided our work. And every time we introduce it, the most common question is, sounds great, but what do we do now? The Limerick Framework for Action is that practical guide to help us move from vision to action on our own campuses and as leaders working with members in our networks. In the U.S. network, we've already started using the 3 Ps from early drafts. We've been building our monthly shared learning discussions around partnership, participation, and progress. We're deeply grateful to the framework team for compiling all the feedback from around the world to create this incredible resource. Today marks another major milestone in our shared global journey toward well-being for planet, place, and people.
For the UK Healthy Universities Network, the Limerick Framework for Action will embolden our membership. It will give institutions the confidence, tools and shared language to take bold action and lead change. By adopting this framework, UK universities can benchmark progress, share best practice and demonstrate leadership in creating inclusive, supportive environments where students and staff can thrive.
Hello from the Australian Health Promoting Universities Network. We acknowledge and pay respect to the First Nations people, traditional owners of this huge country.
The Limerick Framework for Action for us in Australia hopes to be our guiding document that will support our national health promoting campuses movement. Our network is excited to engage with this as we plan for systems-based change and embed health in our policies, practice and culture. This is our moment in Australia to lead, collaborate and to shape a future where every campus becomes a catalyst for thriving communities.
From Wurundjeri country in Melbourne City, Victoria, our network is excited about the work that's been done
and committed to adopting and implementing the Okanagan Charter and the Limerick Framework for Action.
From Yaga and Turrbal country, which is Nyanjan or Brisbane, the Limerick Framework gives us a clear pathway and opportunity to embed health into all aspects of campus culture.
From Awabakal country, Mullumbimba, Newcastle, we look forward to collaborating with this international health promoting community of practice and research. Enjoy the launch. We are with you in spirit. Hey!
Now, I'd also like to welcome our international colleagues, members of the Framework Development Team, Dr. Fatin Ben Abdelaziz and Trinette Lee, our colleagues from the World Health Organization, who will be joining us now online.
Thank you very much. Greetings from Geneva, Switzerland. So I'm Fatin Ben Abdelaziz, Technical Lead for Health Promotion at WHO headquarters. I would like to present my heartfelt congratulations to colleagues from Ireland and all the representatives of the health promoting universities, colleges and campuses for reaching this important milestone. A special acknowledgement goes to the University of Limerick for its leadership in driving the development and consultation process. When I was in Limerick in June, I was very much impressed with the extensive debate, consultation, and consensus building that took place. So I would like also to commend this process, which was very inclusive. Let me take this opportunity to also commend the leadership of Their Excellencies, the Higher Education Authority, the Department of Health, for their combined efforts to place health and well-being at the heart of higher education institutions' mission. The role of the President of the University of Limerick and the Mayor of Limerick for their unwavering support of the Healthy University of Limerick, which was instrumental in realizing this international framework for action. This is a clear demonstration of high-level political support and commitment. When the Okanagan Charter was endorsed in 2015, it called on post-secondary institutions to embed health into every aspect of campus culture and to lead health promotion locally and globally. It provided shared values, principles, language, and solid grounds to advance health and well-being in higher education settings. 10 years later, this movement has been revived to address today's realities, recognizing that the health and the well-being of the people and the planet are deeply interconnected. And in a world of competing priorities and limited resources, collaboration is more critical than ever. The Limerick Framework for Action responds to this call. It reaffirms that higher education institutions as catalysts for transformative health promotion, embedding health and well-being into higher education, core mandate, is actually not a luxury. It is essential. So this vision aligns really with WHO's work on health promotion and well-being, which is about creating the conditions for all people to thrive everywhere in an inclusive and sustainable manner. With the 10 action model for healthier people, places, and planet, the Limerick Framework carries both a political and a technical weight. WHO fully supports this initiative and would like to see this important document into a reality by building strong synergies among the different networks, but also taking advantage of the celebration of the 40th commemoration of the Ottawa Charter for Health Promotion. I believe it should be brought to the attention of high-level decision makers as well in different platforms like the World Health Assembly in 2026 through the diplomatic missions. So with this celebration, we should take this opportunity to really seize the moment to transform higher education institutions into drivers for societal well-being for all. Because investing in health today is investing in the future of humanity and our planet. So again, a big congratulations and thank you for this opportunity to contribute to this amazing work and journey. Over to you. Thank you.
Hi, greetings to all colleagues connected from all around the world. My name is Trinette Lee. I'm the Technical Officer for Healthy Settings at the WHO headquarters in Geneva, together with Satin. A very good afternoon to the Honorable Minister, James Lawless, the Mayor of Limerick, John Moran, President of the University of Limerick, Professor Shinko Cummins, as well as the esteemed representatives from the Department of Health, the Higher Education Authority, the University of Limerick, the networks of health promoting campuses, of higher education institutions, and also the students who are present. And as well, a big congratulations to the team that put together the Limerick Framework for Action. As Fatin and other speakers before me have said, higher education institutions are more than centers of learning. You are the incubators of leadership as well as catalysts for change. Today we celebrate not just the launch of a framework, but the commitment of the movement to transform campuses into environments where health, well-being, and sustainability are woven into the very fabric of higher education. For over 4 decades, WHO has championed a holistic, multidisciplinary systems approach to health through the Healthy Settings initiatives, and the Okanagan Charter, as well as the Limerick Framework, builds on that legacy and provides a roadmap to integrate health, well-being, and sustainability into the functions of higher education institutions. And it also emphasizes empowering our communities, our students, to participate in shaping their environments. So we applaud your vision, your commitment, and your leadership in advancing the global health promoting campus agenda. And as Fatin mentioned, WHO stands ready to support. So thank you for the opportunity to contribute.
I think for those who attended the conference at the University of Limerick, they will have met so many of those faces who contributed with their reflections on what the Framework for Action means for them and how we progress with it. And while this next segment is a separate one, I would hate for you to think that the students are the beneficiaries of the framework but didn't have a role to play in the co-creation and the consultation process. So I'm going to hand over now to three formidable students from the University of Limerick who are here in the room, and they'll be joined by a colleague online to discuss the student role in the development and the implementation of the Limerick Charter.
Thanks, Catherine. Hi, everyone. My name is Aoife Noonan. I am a fourth-year PhD student at the University of Limerick, and the main focus of my PhD was looking into the co-creation research process behind the Limerick Framework for Action. So as part of the 2025 International Health Promoting Campuses Conference, we created the Postgraduate and Early Career Researchers Hub, along with some of the other students that are here today and online. Through this work, we felt it was really important to have a student voice clearly represented at the conference, but also in the development of the framework. So the experiences, needs, and priorities of students are central to creating a framework that's both relevant and actionable. So with that in mind, we have 2 students here today and 1 other online. So Lauren, would you like to start by introducing yourself?
Yes, hi everyone. My name is Lauren Dorset. I'm located in College Station, Texas, and I'm excited to be here with you all today.
Thanks, Lauren. And just to mention, Lauren also successfully defended her thesis there recently, so congratulations. So we also have Stephen here with us today. Stephen, would you like to introduce yourself?
My name is Stephen Oyedeji, and I was the Health UL co-op student, and I'm studying Economics and Public Administration at the University of Limerick.
Thanks, Stephen. And Stephen did really great work with Health UL over the last year or so. And Kathleen, so?
Hello everyone, my name is Kathleen McNally and I am a research assistant with Health UL and the International Health Promoting Campuses conference team. I also completed my master's in UL alongside being a research assistant as well, so I'm familiar with the student experience.
Thanks, Kathleen. So to begin, Lauren, you were actively involved in the Limerick Framework for Action development process, both as part of the data collection process, but also very involved in the Early Career Researchers Hub. So from your perspective, how important was it to include the student voice in the creation of the framework?
Yeah, I had the really unique opportunity to be involved in the Limerick Framework for Action as both a graduate student doing research on settings approaches to health promotion. I also am a current employee of an institution of higher education and also a representative at the United States Health Promoting Campuses Network. And like Aoife said, a part of the Researchers Hub. I think this was a really unique opportunity to provide a wide variety of perspectives, and I cannot express how incredible that was for me. When I think back to the development process for the Limerick Framework for Action, what really stood out to me was how intentional everyone was about bringing many voices to the conversation. A framework like this only works if people who live and learn in that system have a real hand in shaping it. We also know that students create so much of the day-to-day culture on a campus. If their voice isn't in the room, the framework could look great on paper, but not land in real life. Additionally, students are our next professionals. Centering their voice helps to maintain relevance and ensure sustainability for the future of this work. When I got to visit Limerick this summer, I saw that play out firsthand. The students I met were so amazing, thoughtful and inquisitive, and really committed to the development of the framework. And it was even more exciting to see students actively involved in the research side of the framework. So shout out to Aoife and Kathleen for their work. They brought really practical insight from the ground up. They really pushed for the student voice to be a part of this, and I think that's really shaped a much stronger final product.
Thank you, Lauren. Thank you so much for sharing your insights. And it's really great to hear directly from someone who participated in many focus groups and interviews on the IHPC Early Career Hub network as well, and provided many feedback to many drafts of the framework. So thank you so much, Lauren, for joining us today. And along with touching what Lauren has touched on is that students were a really big part in the development of the framework, and building on that, students are also a central focus within the framework itself. And I was part of the framework development team, and when we were going through the data and the feedback from the surveys and the interviews and the many rounds and iterations of the drafts, it was really clear that people wanted students to be a central focus of the framework. So keeping that in mind, my next question is for Stephen. And as someone who experiences the day-to-day life of university, what are your hopes for student involvement in implementation of the framework? Sorry.
I hope that the student voice will play a big role in the implementation of the framework. And we're genuinely involved in the process and decision making. I think our perspective can make a difference and help the framework stay more relevant, stay more grounded, more realistic, and definitely more effective. And I hope that we are represented at the tables where decisions are made. I also hope that it's just not a select group of students' voices are heard, but we involve students with different perspectives and experiences, and we can all work together and contribute meaningfully to the process. And I also believe that students are the heart and life of the campus, and staff play an equally important role in making the campus more lively and shaping the overall community of the campus. So I hope that as we continue to collaborate and work together, we'll be able to make campus better for all and health worldwide. So that's my hope.
Thank you, Stephen, for sharing your insights and hopes for student involvement in the in the framework in framework implementation. I think that's a really important message and one that we can all consider as we move forward. I just want to thank both Lauren and Stephen for joining us for the launch and also their contribution to the framework development process, and also to all the other students across the world who also contributed. And I really hope that you can continue to engage as we implement this framework worldwide. Thank you.
Okay, so we have had a lot of support and advocacy along the Healthy Campus journey, and I'm delighted now to introduce the President of the University of Limerick, Professor Shane Kilcommons, to share his insights on what the Healthy Campus means for the university currently and going forward. Thank you very much.
Thank you, Professor Norton. So it's a real pleasure to be with all of you here today. I think that to see so many of you face to face, but also to have, I think, almost 370 people online. I was very interested in Ross's comments earlier when he used the HEA and celebration in the same sentence. That must be an oxymoron, but actually he's right. I mean, the HEA does so much more than just simply regulation, and he's obviously correct as well in terms of what this is, and it is a celebration. And it's a celebration because, and as so many colleagues online have spoken about, it's a celebration of a shared mission. And I think what we have here today is a coalition of the willing, and a coalition of the willing around educators, health promoters, students, researchers, policymakers, and citizens. And I think that what you're seeing as well is, and I think it's so important, is in that coalition, you're seeing academic, communities of scholarship combining with communities of professional practice to produce noble outcomes. I think the purpose itself is very magnanimous, and that is to create a healthier, more inclusive and empowered learning environments for our students. And I was thinking about this as I came up on the train this morning. And when you think about, I was thinking about the transformation of the higher education sector. And if you think about in this country alone, you think about, the establishment of higher education institutions beginning with Trinity, and then that necklace of institutions that were created around the island in the 1840s and 1850s, and then more recently in the 1970s and 1980s. And when we think about, how they were established as specialist enclaves. They were very professoriate centred. They were didactic. Yes, absolutely, they were about knowledge exchange. But very often that knowledge exchange took place from the expert pouring information into the student, and then once it was completed, you were inoculated for life. And so today, we still follow those noble pursuits, knowledge exchange. It's still a very public good. But I think it's now scaffolded by a myriad of different dimensions, particularly around personal development, and that's how it should be. And, to begin with, we can often see education today is much more lifelong. It's also very much more student-centred. And we see this, and we see this personal development through pedagogies of transition. So how students transition into higher education, how they transition through higher education, and then beyond higher education when they transition out. And what does that mean? So we're no longer just thinking about higher education and knowledge exchange in terms of the specialist discipline. We're thinking about it as a journey around personal development. And that manifests itself in a myriad of ways. So it manifests itself in terms of a focus on graduate attributes. So now we increasingly think about curiosity, resilience. We think about creative thinking of our students. We also think about it in terms of a whole of university education. And we see education now, particularly as students transition in, as being formative. And because it's formative, we see it then not only in terms of specialist knowledge, but also in terms of personal development. And so in addition then to higher education institutions being interested and engaged in specialist knowledge, as they should be, they're also looking at different ways to engage our students around that personal development. And so we see it in terms of the emphasis on sport, we see it in terms of an emphasis on arts and culture, we can also see it through clubs and societies. But in particular, I think health is an integral and critical dimension to this whole of university approach. I think, my background is law, and there's a very famous legal philosopher, John Finnis. He was a professor in Oxford for a very long time, and he actually tried to distill down what the essential public goods are in a society. And the first two he listed, and there was no hierarchy in respect of them, but the first two were knowledge and health and life. And obviously life encompasses health. And so it's natural then that you would see integrations and synergies being created between them, and that's actually what's happening here today. I'm very proud that the University of Limerick has been a leader in health promotion campuses. I'm very proud of our colleagues. They're fantastic ambassadors and advocates. And I think that, you know, it's wonderful as well that they have such good relationships with all of you and with all of the colleagues that were mentioned or referenced in the presentations earlier. I think the Limerick Framework for Action itself is a very important document because it builds on, and I think it complements what was mentioned around the Okanagan Charter in 2015. And I think it was our colleagues from the World Health Organization who talked about its reaffirming potential. And so it's been developed over 18 months involving innovative participatory research. And I think for me what it does is it looks to continue to move the dial from good faith intention to meaningful action with visible outcomes. And again, just in reference to philosophy, there's a very famous Harvard law professor who talked about when you're looking at frameworks or legal systems, he framed them in terms of a morality of duty and a morality of aspiration. And the duty is the baseline aspect that you require before you have a system or a framework, but the aspiration part is where we want to get to. And we're always somewhere, in terms of frameworks or systems, we should be somewhere, because you don't have a system if you're not on the continuum, always somewhere on that continuum. But what actually will move the dial towards, from duty towards aspiration, are the actions. And so it's wonderful to see the 10 actions listed here. They are a practical guide, as one of the colleagues mentioned, and they will certainly move us in the direction of the aspiration that we actually require. I think it's also worth mentioning that the framework itself, it acts as a compass or a roadmap, as kind of Ross mentioned. It's a normative guide to behaviour and to action, and it crystallises it for me around two key purposes. One is to embed health in all aspects of university life, and that speaks to that personal development dimension that I mentioned earlier. And the second is to improve well-being. And so those two purposes are very important. And I think then to have it weaved as it is through the core values of inclusion, sustainability, empowerment and health equity, they're a priori values, something that we can all agree with without negotiation, and something which we should all aspire to. And I think supported by the 3 Ps, and it was wonderful to actually have heard them mentioned already in one of the presentations around partnership, progress and participation. So to see it being lived already, I think is really important. So all that's left for me to do is to express my gratitude to those involved in this project. I'd like to begin by thanking the Healthy UL team, to Professor Woods, Professor Norton, and to Sarah, to Aoife, Kathleen and Stephen. I think that your leadership, your dedication and your commitment, creativity and sense of service is really important, and that bringing together of a community of scholarship and professional communities of practice has been a wonderful coalescing influence, so I'd like to acknowledge your work. I think it's driven by a noble ambition that well-being underpins both personal and collective successes, and that's the baseline that I mentioned earlier on. I think that it is, as the Minister mentioned, I think it's a very ambitious project, and I'm glad myself to be here today to support colleagues and all of you in launching the programme. I think one thing that's also worth mentioning is that this Limerick Framework, that it also is true to the integrity and the fidelity of the Okanagan Charter, and it builds on it and reaffirms it, and I think that's important as well, so that it's not something different from, it's actually reaffirming, and particularly that focus on actions. And so to our international partners, the IHPCN, to Rebecca and Matt, who spoke earlier, to the Charter Renewal Committee, and to all our collaborators, including ATU, Atlantic Treaty University, you have made this possible, and it has been a coalition of the willing. And I heard earlier this idea of magnanimity, a generosity of spirit, and the sharing of ideas, what higher education institutions should be about. So it's reflected itself in the framework that's been launched today. And to our government, to Minister Lawless, to colleagues in the Department of DFERS and Health, a very strong vision for integrating well-being into higher education. It's a noble one. It's a commitment to putting people and well-being first and at the heart of our institutions. And what it's doing is this framework is helping as an anchor point to take us out of silos and to weave personal development through health, through our circuits of engagement in higher education institutions. And so to Minister Lawless, I'm very grateful to him for his transformative vision and the fantastic support and commitment that he's given, and particularly to increase funding to the Healthy Campuses initiative. I think it's an important one. And finally, I'd like to mention the HEA, and so Dr. Tim Conlon is here, Caroline is here, and Ross, I've mentioned already. It's a very close collaboration with the UL team. Its ongoing support and the leadership provided by the HEA has been vital in hosting the event, that the conference that took place in the university last summer. There was over 400 participants. You can hear how warmly they spoke about the event, but it was also, your help has been instrumental in driving this framework. And I think this is an important point to conclude on. It's also, your help has been important in creating a culture of compassion, well-being, and social justice, and anchored through health in our higher education institutions. And so I think I'll finish on that point as a strong point to finish on. Thank you very much.
Thank you very much, President Kilcommons, for speaking so eloquently about the role that the University of Limerick has had to play in this. We're now going to move on to hear from the Mayor of Limerick, Mayor John Moran. We've spoken in the document about collaboration and partnership, and coincidentally, when we were in the University of Limerick for the conference, Limerick City was awarded a Healthy City status. So it's wonderful now to have an opportunity to hear from Mayor Moran on the collaboration that we plan going forward.
Thank you very much, and I hope you can hear me okay, and apologies for not being able to be there in person. But I join with all the colleagues from across the world in congratulating everybody that's worked on the new framework, the Limerick Framework. It's great to actually have the name of Limerick on such an important document at this particular moment in time, because essentially, since I took over as mayor, and I know I met a number of you at the conference in the university, which was a great couple of days, huge excitement and a huge amount of energy around the initiatives. But the reality is that as Limerick is going through its own reform of local government, we're doing a lot politically to put people's well-being, people's physical and mental health right at the center of everything we're doing. And as was mentioned, this has occurred since June of 2024 when I was elected. We developed for Limerick 3 pillars of program for effectively the city and the county, or indeed the broader region. That was the livability of our places in which we live and work and play, so as to make sure that our new housing, new communities are driven in a way where livability is at the front. The prosperity of our region, with a particular focus of mine on the inequalities that occur at the moment in terms of opportunities, and how we can close those gaps in a place, city region, which has got some of Ireland's wealthiest neighbourhoods, literally sitting right beside some of the areas of greatest deprivation. And the third pillar that we adopted for the mayoral programme was to have a more healthy Limerick. And in that respect, it was a great pleasure of mine to have Limerick's application for the WHO be accepted so early in my term, because that has put health front and centre in everything we do. But more importantly for me was actually then the initiatives that have been working alongside that, or indeed been supported by that, and by the focus in the mayoral programme around health. And one of those, before I come to your own one, just to mention, because in some ways these all are so interconnected with each other, one of those is a focus of Limerick becoming the first Irish city region to adopt the Marmot principles for trying to deal with health inequalities, the health outcomes of people dictated in an unacceptable way, simply by, in many ways, the accident of where they're born and to which family they're born. And how we combat that is now a new focus with a new program. But all of that would only work when you have a city like Limerick, which has such a high percentage of third level students and those working in the sector, if in fact the universities in our midst also take this agenda very seriously. And I do want to congratulate the leadership of UL, particularly under the president, for their work in such a relatively short time, in my term at least, where they've put the promotion of a healthy campus agenda right at the very top of the list. In so doing, I suppose what has happened now is that we have seen in the work that the new framework, we've seen that the Limerick Framework for Action really provides a internationally relevant roadmap. And that is one that is so much part of what we're trying to do in Limerick more generally, which is to have global ambition, but local leadership. But local leadership, not just here in Limerick, but leadership that is local to Limerick, but is applying in many places beyond our own island. And for me, it's a really great opportunity as we work through the next couple of years to align what is essentially the academic mission and indeed the civic mission here in City Hall and beyond. And I think if we can make this work within the universities, that for me is not just having a healthy campus, it's actually connecting the people engaged in that exercise with the broader agenda that we have in Limerick. And I think, when you read the framework, when you look at the language, I was listening for the last hour to the type of language that the people are talking about, planning together, acting together, getting a truly collaborative action going, seeing what is happening in all of the different locations and learning from one another, with research playing an important part of that. You can very quickly see how important it is that the implementation of the framework now moves on into the practicalities. And importantly, I think people locally in Limerick know the importance for us here in City Hall of the university colleagues reaching out and both reaching out to us to show us what we should be doing, but helping us to actually achieve that as well outside of the pure confines of the university. Because I think in that respect, it will be, as I'm sure it will be in cities all across the world, something like that becomes really meaningful as this moves on with the new attitude adopted, or I suppose in some respects the same attitude, but reinforced, adopted across the whole student campus, across the whole student body, that the teachers, the others working, will actually help us to achieve the right cooperation that we need to do across our own disciplines and sectors and to the borders. So look, I want to take just this short opportunity to congratulate and thank everybody who's been involved in this project. I was certainly infused by the enthusiasm that I sensed in the room out at the university. What seems like a short number of weeks ago, but it's probably a little bit longer, and I know a huge amount of work has been done since. I did hear, and I was really delighted to hear the support from Minister Lawless about this. I know James well, and I know that when he says what he said in his speech earlier, it is coming from the heart, and he really does want to be behind this, as I do myself. I want to thank Shane, for his leadership in this respect, but indeed actually his leadership across the whole university since he has taken over as the acting president. And what can I say about the two Catherines, if I can call them those, Catherine Norton and Catherine Woods, and the rest of the UL team? This wouldn't be happening today without their own leadership and vision to try and push this along. And I know that Caroline has helped significantly with the Healthy Campus work at the HEA, and that is helpful. So I look forward to continuing to engage on this. I think it will form a really key part of our own third pillar of a more healthy Limerick. And it's just so welcoming and so great if you can become a mayor for the first time ever, a directly elected mayor in a role like this, and to find that immediately there are so many brilliant minds gathered on a conference and together to try and drive forward and do some of the work that I need to do, because ultimately at the end of the day, it's about achieving objectives and achieving results. So thank you very much, everybody, and delighted to be here. And I just want to congratulate everybody for the work you've done and look forward to it all being something that kicks into action now straight away. Thank you again.
So thanks to Mayor Moran and President Kilcummins. We're nearly there. And I know it's probably early morning for some of you online. I keep looking over there. I know you're not there. You're somewhere in the ether. I guess our final supporter speaker, I'm going to introduce her, but I guess for me, Ireland's national policy is real systems theory in action through our partnership with the Department of Health and the HEA. So I'm therefore delighted to introduce Biddy O'Neill, who's the National Project Lead at Healthy Ireland, Department of Health.
Thank you, Caroline, and I don't think there's a whole lot left to be said, but I suppose at the outset just to say that Healthy Campus is one of the settings that we aim to work through, and interesting to hear the Mayor talking about the healthy cities, because I suppose what we aim in Healthy Ireland is that people transition through education, workplaces, third level, clubs, all of the different settings, and that the thread of well-being is integrated the whole way along. So that would be our ultimate goal. And so that piece around partnership working with the healthy cities, healthy counties and other opportunities is really important. I know, for example, that the Healthy Clubs project that we have with the GA, I know that's in some of the campuses. I've heard it's activated in some of the campuses. So that's the ultimate vision, I suppose, for where we are trying to drive Healthy Ireland. It was interesting, I was looking back last night, and the first time the Healthy Campus Network was mentioned was in a health promotion strategy in 2000. A while back. It took us a while to get the action going, but it was mentioned in the context of the settings approach to health promotion. But health promotion was pretty new in Ireland at that stage, and some areas advanced quickly and other areas didn't. But when we eventually got going, I suppose we did gather momentum. And I want to acknowledge in the meantime that there was a lot of the campuses themselves took the initiative, and there was a lot of leadership locally. There was a lot of strong advocates who were champing at the bit for 10, 15 years, trying to get something nationally established. And I suppose the movement came when, through our Sláinte Care Integrated programme, there was some seed funding allocated for the campuses. And then subsequently we got funding for the National Coordinator. We knocked on the door of higher education because I suppose how Healthy Ireland works is very much that other government departments have a key role to play, and we very much saw this as part of higher education. Originally, health was driving a lot of these agendas, but I think the new Healthy Ireland framework allowed us to look at the role of other government departments. The door was opened widely, and we met the Higher Education Authority, and really from the day one, when I met Tim and ultimately Ross, there was really a great welcome and a great openness to work in partnership. And very quickly then, I suppose, the framework was launched, Caroline came into post, and really things moved on. And I'm delighted to say today, or in 2025, we're finally embedding that within higher education, and we have transferred the funding to them because we want them to drive it and own it. And it's a really good example of how we see Healthy Ireland moving forward. We're still in the behind this driver's seat, very much so, because health is obviously still our business. But we really think that you've shown incredible leadership, and it has been really a pleasure to work with you. But I also want to acknowledge the work the HSE did before we got the national piece over the line, and there was pioneers on the ground, as I said, driving the agenda and keeping it alive. So UL then, to move on, I suppose, to this piece of work, UL have shown incredible leadership. It was a real pleasure to work with the team in UL. I actually really enjoyed every minute of it, even the challenges, even all the changes and everything. It was a real pleasure to work with them. And I suppose it's a really good example of when you bring policymakers, academics, implementers, stakeholders into the room, you can really achieve an awful lot, because every perspective is important. My mantra is, if we don't have a policy, we don't have a kind of a mandate for work. So we need all the different pieces of the jigsaw, I suppose, to move this forward. And I really would encourage all campuses, and particularly in our own country, as well, the campuses that haven't managed to put this really on the agenda, to begin to look at the importance of it, and that ultimately that all campuses will embed this in campus life. Thank you very much.
Thanks, Biddy. So I guess we're on to the final piece. So our final speaker today is Tim Conlon, who's Head of Policy and Strategic Planning at the HEA. Tim demonstrates true leadership in respect of health and wellbeing. He really understands how wellbeing intertwines with the broader objectives of higher education and advocates for wellbeing at a senior policy level. And we're really grateful to have Tim and Ross in the system. So just to introduce Tim.
Thanks all. It's a great opportunity to be the final speaker in one way, because you can sum up what everyone said, but then again, everyone has said everything already, as Biddy said. So well, what do you say? I'm also minded that I did a presentation in Japan about 20 years ago, and I was introduced, this is Tim Conlon, and you can stay or you can leave. So if people have trains or things to get, please feel free to run out. I won't take very long. Karen wrote me a very long speech, but as I said, most of it's been said already. Look, what I wanted to say at the outset, listening to the conversation here today about the movement from the Okanagan Charter to a Limerick Framework for Action, and it being the next chapter to re-energise, to renew, to recommit. And a few lines came to mind, and my Canadian colleagues will be more familiar perhaps than the rest of the audience, but first thing, we find a tree, and maybe then we'll talk, or sit silently and listen to our thoughts. Illusions of someday caught in a golden light, no dress rehearsal, this is our lives. And that came back to me today in the context of that we've had time for thought, for conversation, and now moving into a phase of action. I'm also very struck with a worldwide audience that we are not alone or unique in our work, but we also exist in a very challenging world. So I want to thank Rebecca, Matt and Catherine for their comments earlier. There are 10 years between global gatherings, but from June to now was almost no time to have developed the framework. So I really want to thank Professor Catherine Darker from Trinity, the HEA Student, Staff and Wellbeing Advisory Group, and Mark Duras from the University of Lancaster, who's been, who's been a great assistance. I was also struck by the comments of the students, Aoife, Lauren, Stephen, Kathleen, in particular Stephen's point about student inclusion in discussions and conversations, and even more now, again, in a more complex world, to include students, because it's their future as much as everything else that we are considering. I want to particularly thank Professor Kilcummins, President of the University of Limerick. I thought I was President for a second earlier on, I was getting worried. Shane, you always speak so eloquently at these events and around these kind of topics. And you talked about a coalition of the willing, and you very much lead that in your institution in Limerick. And it's been an absolute pleasure for all of us in HEA, and I think the International Coalition of the Willing, to work with the Coalition of the Willing in your institution. And I don't say that lightly. People have moved might and main to get this done. My father often said the best committee was a committee of two with one absent, because sometimes working with people is very difficult, and we all know that. So to bring everyone together and to lead and to drive a Coalition of the Willing is not an easy thing necessarily either. So I very much appreciate that. I also want to thank the Mayor of Limerick, John Moran, again, who speaks with a passion and a meaning in his address. And I shouldn't be surprised about that, but I often am, the way in which John speaks about his vision for a city and for a region. The importance of higher education, of health and of well-being in that is something that I don't take for granted. So I'm very grateful to the Lord Mayor of Limerick for that. Catherine, Sarah, Professor Audrey Tierney, Aoife Noonan, Catherine McNally, again, driving this work forward has really been so significant. We are working across political and cultural contexts, as Rebecca has said. We're meeting students where they are at, as Matt has said. We're working with peers, as Catherine pointed out. And as Shane so well put it, education is a lifelong endeavour. And so the importance of the consideration of health and well-being, of staff and student well-being in that context is really important. For myself, I am also involved in a Bologna follow-up group on fundamental values of higher education in the European context. And the working group, I've briefed them on this work on the conference in Limerick. they remain extremely interested in it. We are at a point of inflection, perhaps in Europe, where we are thinking about the value, the fundamental values of higher education, what academic freedom is, what is the public value of higher education, what is the public value for higher education. And the work that you have done is a really important aspect of that context too. Can I finally thank Biddy and all her colleagues and contacts indeed, for that matter, in the Department of Health for supporting us in making this possible. I'm conscious that we have both the Chief Medical Officer, Mary Horgan, today, and also Deputy Chief Medical Officer, Philip Dodd. And that's really significant to have people at that level listening in and joining us in our work as well too. So I think my key takeaway and my final message for you all is that there's something of a similarity in celebrating diversity. And that has really came through in this work today and in this work internationally. So thank you all for your work. Thank you all for the Limerick Framework for Action, which we will now take forward. Thank you very much. Well done.
Just before we finish, we have a few gifts to give out, if that's okay. Yeah? So Shane, if you would like to come up and present these. Thank you. That's for Catherine Norton. So first of all, for Catherine Norton, to say thank you for leading the bid to host the International Health Promoting Conference and everything that followed on after that. To Aoife, who tirelessly worked on bringing the research to life and the consultation process a reality. To Kathleen, who ensured that the student voice was always front and centre in everything that we did. And to Sarah. Thank you, Sarah, for tirelessly working as Health UL manager. And also to note Audrey, who's not with us today. Audrey's in Uganda on a research mission, so she isn't here, but Audrey, you are with us in presence, absolutely. And we also have two small gifts, one for Caroline, to say, oh, that's Kristen, this one. To say a big thank you for all your help with organising this event and helping out with the conference in general. And finally to Kirsten, if she's still around. Oh, she is. Great. Yes. Kirsten is heading off to Australia tomorrow, so before you go, a very big thank you for your contributions. Thank you all. Thank you, everybody. Thank you.
And for anybody online, I guess that concludes the session for today. And thank you for joining us. We really appreciate it.